Welcome to EFT Nation, your home for all things tapping. For show notes and resources, please visit EFTtappingtraining.com. We are your tapping hosts. I'm Alina Frank.
And I'm Craig Wiener. The information provided in this podcast is not a substitute for counseling or medical advice. The information presented here is meant to inspire and educate listeners, but are not guarantees of any kind.
Okay. Here we go.
Here we go.
I did one of these on Facebook, a Facebook Live that was about the top tips or best practices for integrating EFT into your coaching practice. I felt that this one needed a podcast.
Yep. This one is, we are titling, drumroll please, the 7 strategies for integrating EFT into your therapy practice.
Yes.
Okay, this has been a really fascinating exploration topic for us because at the EFT Tapping Training Institute, when we train and mentor and certify students, I would say probably now 30 to 40% of those people that are attending and moving forward are licensed mental health care therapists and licensed therapists on different levels, right? Depending on whether social work, marriage and family, et cetera, licensed professional counselors, psychologists. Anyway, so for those people, there's a unique perspective of not just I'm just developing this brand new practice, but I already have an existing therapy practice. Mm-hmm. I'm now loving this tapping. Right. I'm loving EFT and matrix reimprinting. But how do I integrate them into an existing practice?
Right.
Okay. So, tip number 1. Okay. Ready?
Yeah.
Let's get started. First, our recommendation is do not waste any time to start using EFT after your professional EFT training. After taking a level 1 and 2, don't wait.
Right. Because what will happen is you won't remember. There are certain things that you will forget if you don't build up those neural connections with the material that you worked in actually working with people. So
like who?
Right. So right off the bat, do you want to, you go through a Friday, Saturday, Sunday training and then start with your clients on Monday? Sure, you can. Or you can immediately start doing swap sessions with other students that participated in the training.
Or
on tapping on yourself.
Absolutely.
Yeah. Right.
And you might have, not officially, but you might have a family member or two that might be going through. You might have a child, a teen, even a spouse. It gets more complicated with family, but you know what?
But there is no hard line in the sand like there is in therapy, right? In therapy, and you were trained that you can absolutely not work with those people. EFT is different. You can actually start practicing that with your friends and family. Right, selective ones.
Yeah, so that you use your own moral compass and guidance. But we just want to talk about the importance of not waiting a lengthy period of time. Yes. Even if you're thinking about undergoing mentoring and certification, but can't begin it for another 2 or 3 months. And
practice.
You don't want to let that big gap of time go.
Absolutely.
Right, so that's number 1.
Okay.
The second thing is, of course, that if you're going to begin doing that quickly thereafter training. So get yourself some training first, of course. Please take, a foundational EFT training if you're going to be using this with other people, right? That's just a bottom line requirement, necessity in my mind.
Yep.
But once you've done that training, and if you're going to start bringing that to your clients, if you have an existing solo practice, that's one thing. But if you're in a clinic, if you have a clinic supervisor, if you're part of an agency, etc., please, of course, find a way to check and get permission from your supervisor, from your higher up, from your managers, etc., to be able to start using and integrating EFT into your practice. That's obvious, but please do that first. And you may need to get some support materials to be able to do that. Right.
Because some people just have no clue what it is. Mm-hmm. And if you're, we go through in our training, like a module called Building Bridges. And that's what we're talking about. It depends on who you're talking to. You might not use the energy bridge with the head of your agency who is very, give me the data, right? So in that case, then the science of tapping would be
You're
a good
getting into tip 3. You are racing ahead of me here. Sorry. So we're going to kind of merge this one into tip number 3 is get yourself some good resources and develop several good bridge building techniques.
Yes.
Right? So go ahead and continue. Given that, whether it's a bridge to your supervisor,
right,
to be able to find, like you were saying,
yes,
scienceoftapping.org, finding research papers. So, and we help with that all the time. You can go to scienceoftapping.org and you can find the meta-analyses, the randomized controlled trials. There's a lot of things out there to bridge that technique from a more science research base with your supervisors, for example, or administrators. But you also want to develop those bridges to your clients.
Right. And so I would say the .org is pretty good, but the .com is where you can actually access, as a member, you can access links that you can give clients so that they can actually get some buy-in. But other things that you find good, solid resources that you can send clients, but you might want to sort of pre-frame that, oh, this is a new technique that I am trained in, and I think it would be helpful, and here's why. Give them some idea of what it is that what it looks like. You might give them a tapping chart that you've developed or that you have gotten, and explaining what it is that you do, maybe going through the points, tapping on yourself to show them what it's like. A good bridge might be counter conditioning. It might be that we're bringing something gently up to the surface, and then we are, using these acupuncture points that where it actually changes how you feel about something pretty rapidly. So it's simple, but thoughtful. Always keeping the listener in mind. So that you don't spring it on them, in the middle of, let's do, it depends on your client. Which clients are going to be always, what, am I going ahead to?
Yes, you are.
I am.
You are ahead.
I should have looked at the list.
There you go.
Go ahead.
Strategy and tip number 4. Please pre-frame your tapping sessions.
There you go.
Okay. In advance, right? So that the client understands the contrast and the context of what you have been doing and what you are doing. So if all of a sudden in the middle of a CBT session or a DBT session, all of a sudden you start saying, okay, tap on the top of your head, right, that's going to be abrupt and that's not going to flow.
Right.
So by having those resources that we were just talking about, and you're thinking, wow, I think that this person might really respond well to EFT, then you can advance. Yeah. For example, provide them some information, some research, some resources, because next time we're going to try something new and it's going to look and feel different. Right. So there's safety that's developed in pre-framing the initiation of introduction of tapping into the work, and that's really important because it's going to look different and feel different. There's going to be a different tempo to it, more than likely. There's going to be a different style, let alone just the tapping and the somatic element, right? Right.
Yeah, and that's a good bridge to use for people that you've been doing somatic work with. Somatic energy modality or stress reduction modality. So, yeah, and this all goes back to how much rapport, trust, and connection you have with your client. There are some that you're going to want, that you feel they're going to respond really well for you to say in the middle of a session, I just learned this thing, and are you willing to give it a go? And there are others that you really do need to lay a solid foundation before ever trying it, or especially trying it on something like a trauma.
And one of the beauties, tip number 5, is that EFT is not only something that's a therapeutic intervention from a practitioner to a client, but one of the real beautiful elements of EFT is its application as a self-help and a self-regulation technique, right? So please make sure, and this might be all that you do at the beginning. Oh, yeah. Right?
There are plenty of therapists that that's all they do.
Right. So they teach their clients how to self-apply EFT in moments of anxiety and anger outbursts, or during cravings, during addiction phases. So all kinds of different applications for self-regulation. So make sure that you take the time to have the resources, as you're saying, whether it's the tapping handouts or explanation or short video that you create, that helps them to be empowered to use it on their own. So please don't ever assume. A lot of times I see practitioner therapist using EFT with a client and then saying, okay, so remember to tap this week if you feel anxious. Please set extra time aside. this is exactly how you break it down and do it. So let's do this together. So when's the next time this might happen? How would you do that? How would you create a setup? How would you tap? Because you want to keep them safe. I am not recommending that you have, especially early on, a therapy client that you're doing historical work with them from their past or childhood, of course. So this is about in the moment, present tense, self-regulation tapping when they're feeling overwhelmed, stressed, anxious, worried, etc.
Absolutely. Right? It's a great tool for that.
And then check on that. And next time, in the next session, how did you do with that? How did that go? Oh, you weren't confident in this. You weren't sure how to do that. Great. Let's spend some more time with that. So really making that a very vital pillar of your work together.
Right. And the self-tapping, we're talking about tapping without words. We're talking about doing things like orienting tapping. Yeah.
Okay. All right. Okay. Number 6. Please take the time and effort to learn more about trauma-informed approaches to using tapping, because, the beauty of EFT is just how deeply it can go quickly. And the danger of EFT is just how deeply it can go quickly, right? So somebody's current worry about an upcoming confrontation with their employer or whatever that they're worried or stressed about quickly goes back to earlier trauma, childhood trauma, etc. So I used to believe that anybody that was a licensed therapist had lots of trauma training. To me, that only made sense. And being told time after time after time after time after time from so many of my colleagues in the licensed mental health field is like, that's not true. So, that's why I developed the course and co-developed the course, Tapping Out of Trauma. .com. You can take that out, but you can't even take that until you've taken a level 1 and 2. But however you're going to become more trauma informed with the application and integration of how to use that with EFT is critical, right? It's such an important part. Anything else you want to add about that?
No.
Okay. Tip number 7. Please make sure that you are at peace with EFT's not going to help everybody. Or always the right time. I mean, we it's so easy to get excited when we observe or experience the power of EFT that many people come away just with this incredible enthusiasm to use it all the time and with everybody and all of that. And you know what? Nothing works all the time, and nothing's the right technique for everybody.
And some people really like what you have been doing with them all along, and they don't want to change.
Yeah.
They would rather just stay the course. Now, I see many of my mentees who are licensed mental health care professionals hit some kind of period, a moment in their EFT certification journey when, if all they've done is worked on their clients, right, or patients, there will be a time where they become a little disheartened that not 100%. Like there is this morning, like, oh, I really wish they would. And there's this person that really needs to change, and this is what would really benefit them. And so, yeah, acknowledge that. You could tap on how you're feeling about a particular person not wanting to do it when you know it would be so beneficial. But, or you can consider starting an EFT practice on the side where people just come to you knowing full well that that is what they want.
Yeah. I mean, I've seen the same therapists that are maybe on the kind of the part of their timeline of their career where there's a bit of burnout going on.
Yeah.
And in that, somehow a colleague or somebody introduced them to EFT, and then all of a sudden there's this renewed enthusiasm and excitement. And perhaps, you know what, they're looking and they're ready for a change in their practice. They're ready for maybe a move to a non-insurance-based, cash-based kind of practice. And EFT can fit really well into that. And the development of kind of a dual practice, one being a therapy practice, one being a coaching practice, and the coaching practice being primarily EFT-based. So, I mean, there's so many different issues and concerns and possibilities that we can go on and on. But I just wanted to kind of have a quick, swift top 7 tips to consider when you're looking at integrating into your practice. And there's a lot more, and you can always contact us if you have questions. And a great organization. Also, if you're a licensed therapist, for lots of support, it's called the ACEP, ACEP, Association for Comprehensive Energy Psychology, that was built out of licensed therapists that were looking for fellow colleagues, right, and professionals to do somatic and energy work. And so there's a lot of great peer support there as well. So anything else you wanted to add?
So no, I don't think so. I think we pretty much covered it all.
Okay. All right. So that was quick, easy, boom, boom, boom. Hopefully those helped. Let us know if you have any questions. Thanks for joining us today at EFT Nation. And remember that you can find show notes and previous episodes at EFTtappingtraining.com.